May is Lupus Awareness Month. Although it can strike men and women of all ages, 90% of individuals diagnosed with the disease are women. Dr. Paula Walker-King here to discuss it this morning. Bit of a mystery ailment, isn't it?
It is a bit of a mystery ailment because we don't know what causes lupus. It's believed that there are some triggers that are probably environmentally based. There may be a little bit of a genetic component, but overall we don't know the etiology or cause of the disease.
We chatted a little ahead of time. You say it's an autoimmune disease. What does that mean?
This is an autoimmune disease, so that means literally the immune system, which is designed to protect us from outside pathogens and things that can actually cause us harm. The immune system literally in this disease turns on itself and begins to attack different components of itself. And so the immune system, because of this breakdown, leads to the manifestation of these various signs and symptoms of lupus.
All right, now what are the risk factors of lupus?
Risk factors, gender is a risk factor. It is 90% of cases are seen in women. Ethnicity, African Americans are slightly more increased risk of developing lupus. I don't know if you knew Michael Jackson had lupus. He's one of the rare men that has lupus. Yes. Other risk factors include age. Between the ages of 15 and 45, this is where we see most cases of lupus emerge. And so these are the predominant risk factors, along with family history. Sometimes there's a pattern of lupus and other autoimmune illnesses in a family.
But we don't know what causes it.
We don't know what causes it, just these contributing factors. And so what we're always warning people, if they notice any type of rash, typically lupus has a characteristic butterfly rash that develops over the face, and I think we had a picture there on the screen. That's typical. They'll be sensitive to light. If they go out in the sun, that rash and other similar dermal skin patterns will develop. They'll develop swelling and pain of the joints, a lot of fatigue and headaches. And so it's really a systemic illness. It really affects multiple areas of the body, multiple organ systems, and it can lead to heart disease and some other issues within organs.
You mentioned a woman who was diagnosed with heart disease at 19.
She was diagnosed with heart disease at 19, and she passed away from lupus by the age of 26.
Goodness gracious.
Yeah, so it can be very devastating.
It can be fatal.
Yep, but there is treatment, and so there is hope.
And what are the treatments?
Well, the treatments primarily are steroids, immunosuppressants, and anti-inflammatory medications. They do have some specialized drugs like Benlysta on the market that are targeted for lupus, but more likely, usually we use the immunosuppressants, and even the anti-malarial drugs have been shown to be helpful in treating some of the symptoms of lupus. So people don't have to suffer. So they just need to get plugged in with their primary care physician and follow up with a routine plan of care.
And we are now a little more aware of lupus during Lupus Awareness Month.
That's right.
Good to see you.
Great to see you too.
Dr. Paula Walker-King. Let's get a check on weather now. Here's Lauren.